it's Joyce Gibb, and I really would like to thank you for being with me today. I got an email from a listener that had a question about nattokinase being a natural blood thinner. And I'd say, yes, this is. We have natto 100, which is nattokinase, and that, Joe used to say, it makes the blood slickery, so the platelets don't stick together very much. And so that's one. I would recommend that, but you don't want to take that with another prescription blood thinner like warfarin or Coumadin, Xarelto, Plavix, etc. So it should be taken on its own, only because it can increase the risk of bleeding. Even omega-3 800s, high dose, 5 grams a day or more or less, can also increase the risk of bleeding. And that is why they always say before surgery, stop your omegas, stop varying, nutritional supplementation just because of the risk is increased. They're not sure what exactly causes it. Are there a bunch of studies that proves the increased risk? Not necessarily. So just to be safe, most physicians traditionally recommend stopping blood thinners. Some other things that can actually thin your blood. So if somebody's on Coumadin or warfarin, they really like to limit their dark green leafy vegetables because that can raise your blood sugar, your blood thinning level. So they do an INR, and most people do 1.5 to 2.5 is the range. And they say, oh, you can't eat leafy vegetables when you're on Coumadin. Well, I don't agree with that. What I would say is try to consume about the same amount of dark green leafy vegetables every day if you can, and then they do the blood testing on that. Some other things to do to keep your blood thin is not to eat meat that is high, that's char grilled, because that increases advanced glycation end products. It's called that helps with clotting. You don't want to clot. You don't want your blood to clot. So, and the risk of pulmonary embolus, stroke, heart attack goes up with that. So doing, higher dose omegas is another option. Some people say recommend a baby aspirin. Now, I don't typically recommend baby aspirin as often. Now, if you have factor V Leiden deficiency, traditional medicine says take a baby aspirin a day. Are there studies that proves that nattokinase is just as good as aspirin? No. But that is increased risk. And I would never, ever tell anybody to not do what their doctor told them about, specifically about a clot like that. But I would like to discuss this further with you, and come and see me, and I'd be glad to talk about it. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.